Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crow, Director of Professional and Community Education at Care Dimensions. And I am so excited to welcome our guest today, Francine Temkin. And I'll tell you, our show today is about November is actually National Hospice and Palliative Care Month. And today we are focusing in on the caregiver. And Francine is a caregiver, and she's going to talk about her caregiving experience with us today. And Francine, thank you so much for joining us.
Oh, it's my pleasure. Thank you.
I'll tell you, it's just, I always say, and I feel this from the heart, it's just so, to me, it's so generous of people when they're willing to share their story in this way, because it helps so many.
Mary, it's my pleasure. It's just a way to give back. And I just feel when I talk about my parents, they're still with me. So it's a wonderful thing. So thank you.
Thanks, Francine. Well, tell us, please, jump right in, because I know this goes by like 5 minutes, and I could talk to you for hours about this. So please tell me about your caregiving. Tell the audience about your caregiving experience.
Sure. First of all, I'm very, very lucky. I had wonderful parents, and they had a very long life. I had to move them from their home to an independent living, and then I had to move Dad into a long-term care facility. And I always promised them I would never, ever move them into a long-term care facility. When we moved them into independent living, I felt I could her in, but at that point, Dad could not walk any longer, and he had to go into long-term care. The long-term care facility I chose was absolutely wonderful, wonderful. At that point, I was like, my mom can't live alone. She needs to live with us. And my husband right away said, oh, your mom's coming to live with us. So that was amazing in itself. The support system I have between my children, my brother, my husband is absolutely wonderful. Dad now is a long-term care facility, and he goes on hospice care. And hospice care, that means he's going to die. And that was a very scary revelation. It was like, this cannot happen. And the hospice nurse, as well as the long-term care nurses, were like, no, this is not going to happen. We are going to take care of him so that he can have a nice quality of life. And that's just what they did. Dad was very happy. The facility was wonderful. They had activities. People were coming around. So that negative fact of going to a long-term care facility was not negative. It was an absolute positive experience. My husband and I both will say, if we ever had to go in a long-term care facility, it's okay because of the support that we received. Probably about 6 months later, and so at that time when Dad was in a long-term care facility, some of my family members were not happy that I was putting Dad into long-term care with hospice. And I explained to them, nope, hospice is going to help. He's still going to be on medication. We have a lot of support system. Certain family members would not listen to what I had to say. I was very fortunate that the social worker from hospice had a meeting with the individuals that were not in agreement with us and explained why they were going into hospice and what was going to happen. So it took it off my plate, where you had professionals explaining hospice care and not like all medication comes off and at the end of it. It was wonderful. It was absolutely wonderful. I also needed support, and my children needed support, because again, it's pretty scary when you hear somebody's going on to hospice. The social worker that I had from hospice care was absolutely phenomenal. Phenomenal. She was just absolutely wonderful, would explain things to me. She says, you may feel guilt later. Do not worry about that. That's a normal situation. She was just wonderful, absolutely wonderful. Roughly 6 months later, now Dad's in hospice care. Mom was living with us. I was able to bring care into the house, which was wonderful. One day, Mom is living with us, and she could not walk. She could not get up off a chair. We had to take her by ambulance to the hospital. And the doctor said, you've got 3 weeks and Mom is going to pass. I was like, this can't happen. I was hysterical. I was able to call my hospice nurse from the hospital. And I said, Deb, mom is dying. She's like, what? I go, mom is dying. She goes, what are you talking about? So she had to stop the car, and I explained. And she said, you let them know that we're going to take care of you. You do not have to deal with hospice. Everything is taken care of. I will take care of everything for you. The next day, mom was also on hospice care. And my nurse and my social worker made sure that I had the same team. They were not going to change. It was amazing, because it's like I cannot lose both of them. They were absolutely wonderful. So now mom is put into, and again, we are very lucky and very blessed, the same long-term care facility as dad is. We did not put them in the same room on purpose. And they could have gone into the same room. But mom worries about everybody, and she would have worried about dad. And so even the nurses at the facility said, no, at this point, we're going to keep them separate. They saw each other all day long. And then when they could feel mom would get agitated a little bit because she was more concerned about dad, they would move mom and have it be with other groups of people, which was a wonderful, wonderful thing. So it was just, the support system I had was incredible from both sides. Mom and dad are just wonderful, wonderful people. Everybody loves mom and dad. So when it came to their anniversary, hospice said, oh, well, we should have an anniversary party for them. And hospice brought in music and cake and food, and we invited family and friends into the facility. Mom and dad were thrilled. We all were thrilled. We still have pictures up all over the house of us having an anniversary party for mom and dad. Then my nephew got married, and mom and dad couldn't attend the wedding. So they worked with my nephew to have a wedding through hospice in the long-term care facility. They had a miniature wedding for my nephew. I cannot thank hospice in the facility for everything they've done for us. Incredible, absolutely incredible.
Yeah, thank you so much. I'll tell you, you hear the story, and I just, so many things come to mind, because, a lot of times people have these myths and misconceptions, Francine. And you talked about it initially when you said, oh, no, hospice, oh, that can't be, they're going to die. And really, again, it's so important, and you've lived this, that you understand that, the focus when people are on hospice is not about dying. It's actually about living, and about living fully for whatever time they have left. So that's a misconception. Oftentimes people think you're coming on hospice and you merely have days or hours to live, but that's not true either. People can be on hospice for quite an extended period of time. And again, it's all about quality of life during that. You also mentioned too about how the support for you, and I love that about hospice, is that it's support for the individual, but even more too, it's support for the loved ones around them. And again, it's something that people don't necessarily know. Another point, again, you talked about so many things, and I think it's important to highlight these things for the audience here that is listening to you today, because again, a lot of times people really don't understand hospice at all. You also mentioned about going into a facility. Hospice, sometimes people think hospice is a place. It certainly, there are inpatient hospice facilities. We have two of those, the Kaplan Family Hospice House in Danvers and the Care Dimensions Hospice House on the Lincoln-Waltham line. But hospice is a philosophy of care, and it can be provided anywhere that person calls home. And sometimes people aren't aware that if they're in a long-term care facility, like you were speaking of, that they can also have hospice there too. To me, they're not doing the same thing. Hospice brings an expertise in around end-of-life care, and what it does is it actually complements the care that is already being provided in the facility. To me, it's a marriage made in heaven, right? Because again, you're getting that extra support too. And it sounds like that's what you realized through this process.
Oh, absolutely. And something else that you just triggered on. So when mom was passing away, dad passed away, and I was too afraid to be with dad because I thought it was going to be scary. So I wasn't with dad when he passed, which I to this day feel bad because I saw how beautiful it was to be with mom when she passed. And that was because of hospice, the hospice nurse and social worker and the long-term care nurse, because they said they had a feeling when mom was going to pass. I said, is it scary? She said, it's not going to be scary because the fact that she's on hospice, we want to make her comfortable. So she says, it's not going to be scary. So I stayed at the long-term care facility for 2 nights. The last night, I got into bed with her like 4 o'clock in the morning, and I was talking to mom, and I just said, and it was, I tell you, it was beautiful because I said to mom, I'm lying in bed with her, and I said, Mom, we're going to have a snowstorm. It's going to be 18 inches of snow. You're going to be able to be with your family. Aren't you lucky? You'll see your sister and your brother, and I mentioned different relatives. And I said, and Mom, you have to help me make brisket. How am I going to make brisket? And the next thing you knew, she fell right to sleep, and my hand was on my heart, on her heart. And every time I touch my heart now, I know she's with me.
Yeah.
I left there, and I was probably with her not even 5 minutes in bed. I go outside, I go, Mom died. It was so beautiful. I am so happy. It was so beautiful. And again, that is because of you guys.
Yeah. Well, thank you, Francine, and thank you for sharing that beautiful story. And I want to ask you too, because it matters. It matters so much to the loved ones how that person's death goes, and again, how it affects your bereavement, right? So it kind of sounds like that mattered greatly in terms of the grief that you've experienced after she died.
Yeah, it absolutely. It's like again. I believe they're still with me. Of course, I still talk to them and all that. And again, I had wonderful, parents, we have wonderful family and all that. But the support system telling me it's going to be okay. And then I slept there. It was, how do you tell somebody that they died and it was beautiful? It was beautiful. It was beautiful. There was no pain. She went to sleep, and I know she's happy.
Yeah.
Do you know what I mean? She's with dad. The two of them are together.
Yeah.
It's wonderful. It's wonderful.
Yeah. And I do want to just to emphasize your point too, because sometimes people look at death as that it's only about, deep, and it is, and there is sadness and there is suffering around that and all, but it's a time also of great growth and healing as well. And that's exactly what you seem to be describing, Francine.
Well, it's because of the care that mom, because of the love of the family, and again, we're such a loving family, and the care that I received in long-term care facility, and the support system I had from hospice care, I volunteer now at that long-term care facility and for you because I need to give back because you were so wonderful.
Oh, isn't that great? I'll tell you, and it's wonderful and that keeps on giving in that way. I wanted to say too, you were talking about again just being in the facility, all of that. So it's so hard for family members sometimes because we make promises and sometimes, but the reality now is that we do need. It takes a village to take care of our loved ones, right? It's not something we can do alone. And I think one of the kindest and most loving things you can do is we can't always keep them at home, but what we can do is we can make sure that they're in the place where they're getting really good care. And that doesn't, as a caregiver, your caregiving role didn't stop, as you saw. It was very much ongoing, but you just called in the troops, if you will, to help them.
Exactly. I actually retired because I needed to take care of my parents. Do you know what I mean? Even though they were in the long-term care facility, and also knowing, thank God, that I was having 2 twin grandchildren. So between both, it was like, okay, I think it's time to retire so that I can take care of mom and dad. And thank God we were able to do that.
Right, right. Well, the other piece you talked about was the educational component because you can see how families are in different places around this. So you talked about, you had come to terms in a different way and you had other family that didn't have a good understanding of hospice and what they were going to offer and how they could be a benefit. And then so the team was able to come in and sit and meet with them to further educate them on that so that they could actually have some peace of mind as well. So the educational component is very critical too.
It is, and having the support of the Care Dimensions team explain to the relatives, therefore it's not coming from me, it's coming from them. So it's not something Franny said, it's like, no,
Yeah.
they're talking. And that took it off my plate, which I thought was really important.
Yeah, absolutely. So what was it talk? I want you to talk more about the experience too for both of your parents in terms of the support that they received from hospice care.
Mom and dad loved the support that they received because they had visitors. And I never told, so when dad was on in the long-term care facility and he was on hospice, I never called it hospice because I thought that would be a negative connotation to dad. So I said, Care Dimensions is coming in. And I said, you get to see this person and that person. You can have a massage, you're going to have music. He's like, great. I said, Dad, you're going to have a veteran come in and talk to you about World War II. Well, he thought he was like having a great time because I didn't word it as hospice. It was like, you're going to have more people come in to see you. So dad was thrilled about that, absolutely thrilled. And then when mom was in the facility, it was the same thing. And again, they had musicians come in from Berkeley who were absolutely fabulous. They even gave mom and dad a massage. Like, we never had a massage before. And again, they had volunteers come in and visit with them. Yes. So they were very happy. Mom used to sit there. This was even after dad passed away. And I'm not sure sometimes I think mom knew dad passed away and other times, did dad pass away? Because mom had dementia. So it was like, maybe, maybe not, that kind of thing. But I remember visiting mom in her room, and they have a great room that they visit in. And mom would look at me and goes, Franny, look where I am. I am so lucky. Look how lucky I am. And I would say, Mom, no, we're lucky. She goes, no, Franny, look at this. I am so lucky.
Yeah.
Well, how can you complain about that?
Oh, how wonderful, how wonderful. And again, there's that different component because what I want people to understand too is because sometimes people think hospice is just for people who have cancer, but it's not. It can be for any disease really. And if a person, again, is terminal in nature and it's expected that they may not live beyond a 6-month period of time, although people can live beyond that and continue to be on hospice. So you can see with your mom having a form of dementia, all of that, and there was extra dementia support around that too, because again, we have a dementia support program. So it was nice that you got to really access those types of services as well. Tell me some of the other benefits that you felt, like what from your experience as a caregiver. What were the things that resonated the most for you and what helped you best having hospice involvement?
I think I was very fortunate. Number one, again, I keep telling you that my parents are wonderful. They never questioned anything I did. I was their support system. So if I said, as they got older, this is what we should do, they were like, okay, hon, if that's what you think we should do. So I was very, very lucky about that. And again, when I questioned what to do, I could call the social worker and the nurse, and I would just call them, and they would answer me all the time. There was one time, yes, that was it. So they would just answer me all the time. So I could just pick up that phone, and that was a big deal. That was really a big deal.
Sure.
Yep.
Well, I think that accessibility, because again, one of the benefits of hospice care is that, people think that it's 24-hour care, like round the clock living. It's not that. It's intermittent care, but you have 24/7 access to it. So if you are in, if people, and like I said, it can be anywhere the person calls home, you happen to utilize it in a facility, but it can be in a home or it could be in a hospital setting, it can be in a long-term care, assisted living, anywhere the person calls home, they can receive that care, and they have access. So at 2 a.m, if people are feeling emotional or physical or spiritual distress, you can reach somebody. It might not be that person on the team, you were getting them through their day hours, but you will be able to access, and there's somebody, clinical staff that will go out to see that person. So I like people to understand that too, Francine, because sometimes people aren't aware. And like I said, a lot of support for the caregiver. And so talk more about that too, some other types of support that you felt as the caregiver having your parents on hospice.
It's interesting you say that, because I've had friends that have been on hospice and they were not in a long-term care facility, and they didn't have all of that support that I had. And I think having the benefit of, again, being in that long-term care facility with hospice was a match made in heaven, because I just think it just gave me anything I questioned, they were always there for, there for me.
Yep. Yeah. Yeah.
That kind of
So it sounded like, again, you kind of had the structured environment with them in the facility. And like I said, that added complement and benefit of having hospice in as well. So it sounded like, again, it was just a very good fit for all of you.
It was. And then even when Dad was passing and Mom was passing, these social workers sat with me and the family in that in that facility, and it would have been at home, just waiting.
Yeah.
So it was like, I wasn't alone,
Yeah.
ever, kind of thing. And that, they just sat. I mean, she saw that we were okay, but the social worker was just sitting there just to make sure that we were all okay. And that was wonderful. That was wonderful.
Yeah. You can't minimize the kind of support. This is such a trying time for people. This is such an impact. I mean, that parental relationship, losing anyone, but certainly, again, it's a profound loss to lose a parent, and you're losing two in a very short period of time. What was that like for you? Because losing one parent alone is so significant. You've lost two in a very short period of time.
That's really funny that you say that, because it was really quite interesting. So Dad is in a facility, and now Mom has to go into the facility, and they gave Mom 3 weeks to live. And in what we all thought that if Dad, because Dad was ready, he could not walk anymore, and he was, he used to drive places and things like that. So he did not like being in a nursing home with care dimensions or anything. He wanted, enough is enough. So we always said, if Mom dies first, Dad's going to go immediately.
Mm-hmm.
But if Dad dies first, Mom may not, because she'll have to still take care of all of us.
Mm-hmm.
So it was, now Mom and Dad are now in the facility. I'm at the gym, and happens to be that the rabbi is at the gym. And I'm like, okay, so Mom, they just gave me 3 weeks. They could die together. Mom and Dad could die together. Could they? So I said to the rabbi, could they be buried together? Because then they're going to be holding hands. And I said, could that work? And the rabbi said, they can't be buried together. I'm like, they can't? Do you know what I mean? And she was like, they can't. And I was like, because at first it was like, they would want that. They would want that. So when Dad passed, of course it was hard, but he was so ready. And then when Mom passed, I will never forget being at the cemetery, and she's being buried, and we were happy because now Mom and Dad are together. Mm. I mean, so it was just, it was, again, we were like, Mom and Dad are together, holding hands, like they would always want to do.
Right. Yeah.
Like they would always want to do.
Yeah. If you were, in terms of, as a caregiver, having utilized hospice care for both of your parents, what would your words of advice be to people out there who maybe don't understand hospice, who maybe again are more resistant to having that care or understanding? What would you share with them about again your experience, or what just kind of your words of advice to them would be?
It's funny that you asked that, because I have shared hospice experiences and suggested to people that they should, their loved ones should go on palliative care. They should go on hospice care with Care Dimensions. So I have mentioned it numerous times. And when I mention it to the people, it's because of the support system and the security blanket that you as a caregiver has. I'm not so concerned about the patient. And I used to say this all the time. What about the caregiver?
Yeah.
The patient, whether they're in their 60s or 80s or 90s, whatever, the patient's being taken care of. What about the caregiver, whether they're at home 24/7 with the person that's sick or at a long-term care facility or wherever? That person is the one that needs the support and the break.
Yeah.
That to me is so important.
Yeah, so even having a loved one on, like I said, because we are so focused sometimes, and people do focus on the individual, but when somebody is dying, when we're losing a loved one and they're dying, it affects everybody. It affects all of the loved ones and that whole support system. So that's again what I love about hospice, is it focuses not on that, just on that individual, but the whole support system. And I always say family is anybody that loves and supports you. It doesn't necessarily mean blood relation. So that whole system needs to be tended to through this. So it's, I really agree. Sometimes we don't, and there has to be more focus on caregiving in general, because the reality, Francine, in life is, as our loved ones live longer, right? And because of advances in medicine, technology, all of that, the likelihood of us being a caregiver in our life is very high. That everybody at some point will be put in that caregiving role. So I am so very grateful that you're sharing this caregiving experience with people.
No, it's my pleasure, because it's just a way to give back and to help other people, and to realize it's not negative being on hospice. It can be a wonderful, supportive experience.
Yeah, absolutely. So, I know we're going to wrap up in a second, but if there's anything else that you want to share before we do that, I invite you to do that. And again, I just can't thank you enough for your generosity and your time and being here today with us.
Mary, it literally is my pleasure. And I cannot thank Care Dimensions enough for all that you have done, and recommend highly how important it is, if need be, to go on hospice and palliative care. It's so important with Care Dimensions.
Thank you so much, Francine. So, and I want to thank everybody for tuning in today. And I'll tell you, this is a very special program on caregiving. And I hope that you all get so much out of this. And again, just thrilled to have Francine Temkin on this program. So I look forward to you all tuning into the next program of Timing is Everything.
Home. More than ever, it's your sanctuary. But if you're caring for a loved one with advanced illness, it can feel isolating and worrisome. Care Dimensions can help. As Massachusetts' leading hospice provider, you can count on us for guidance, medical care, and support. We follow all COVID-19 safety precautions to protect you and your family, so you don't have to delay getting the care you need. Visit Care Dimensions online or give us a call.